Hello, this is Janet Michael. In addition to hosting The Valley Today each weekday at noon on the River 95.3, I also produce podcasts, and I'm excited to introduce you to a new podcast series in partnership with Lord Fairfax Community College. Having provided higher education and career training for the past half-century, LFCC is tightly interwoven into the fabric of the Northern Shenandoah Valley and Piedmont regions. Join me every week for conversations with current and former students to hear their funny and inspiring stories as we learn about their journey to higher education, the role that LFCC has played, where they are now, and where they plan to go. We'll also talk to current and former professors about their experiences and best memories of LFCC over the past 50 years. Get every single episode as they're released on our website at theriver953.com under the podcast tab, or you can subscribe for free in Apple Podcast, Google Podcast, on Spotify, Amazon Music, wherever you listen to podcasts. Just search for LFCC Stories. Hello and welcome to The Valley Today. I am your host, Janet Michael. Happy Thursday. As you are listening to the show today, we have pre-recorded our conversation on the Zoom screen with one of my, I get the feeling he's going to be one of my new best friends. It is Community Health Day. So that means we are chatting with someone from Valley Health. They are our community health partners. So I am on the Zoom screen with Dr. Mesfin Shibeshi.
You got it.
Ha! I didn't even cheat and ask anybody how to say it first. So I'm pretty proud of myself.
I think you should be. You're absolutely right. You got it right.
He is a board-certified orthopedic surgeon with Valley Health Orthopaedics. I understand that you share the office with Dr. Mitchell, who has done the show with me before.
Absolutely. An outstanding partner. We've been together for a couple of years. You know, I often joke that he might be a better surgeon, but I can outrun him physically. I think he's a great partner.
He's a big guy. He's an old football player, though. So he's got the bulk where he may not necessarily have the speed.
I think he thinks he's still a college football player, but that's a couple of years back.
I really appreciate the time that you're taking this evening. I know we were chatting before we started recording that you've been in surgery a lot today. So I promise I'll try not to ask anything that exhausts you more than probably being in surgery all day. So one of the things that I read about you is that you are a total joint fellowship trained provider. And I understand that is kind of a big deal. So can you explain what that is and how it impacts the quality of care that you can provide?
So basically, most orthopedic surgeons, especially, has been trained where once we're done with 5 years of orthopedic residency, most of us will choose what's called an extra training, what's called fellowship. And there are many fellowships that you can do. So you mentioned Dr. Mitchell, he had fellowship training in sports medicine. And I'm sure he explained to you what that means. For joint replacement, what that essentially means is not only we're able to do the primary hip and knee replacements, but we're able to do, and we're especially trained to deal with any associated complication that has been previously done by another orthopedic surgeon to kind of redo anything that was not, the outcome was not what was expected, or any complication that sometimes you don't foresee all the complications that can be corrected, that we can do the revision. So this adult reconstruction fellowship essentially gives you 1 whole year of training doing nothing but hip and knee replacement and the revision. And this includes total joint replacement that was done a few years back, 20, 30 years ago. They are worn out and things are not doing well, taking that old implant out and revising it to the new system. So these are some of the gist of what this fellowship trained joint surgeon basically means.
Now, is this something that you always knew that you wanted to do? I mean, were you the kid that played doctor when you were in grade school, or how did you come to choose this as your specialty?
Well, it is. That's an interesting question because I came from a family. My dad was, he was a PA and he was around the hospital. And I've always, not so much him, but he has had many physician friends that they used to literally let me sit on their lap and let me see. I was born, by the way, I was born in Ethiopia. So they will let me see all not very flattering things. And I've always been very interested. But fast forward, I did my high school in Dallas, and then went to college in Oklahoma. And I was a pre-med student in Oklahoma. And then once I went to college in Oklahoma, I ended up being a physical therapist actually. And I had great time as a PT. I was a single person, good job, traveled the world. But I always want to come back to medical school. But once I came back to medical school, I actually did not want to pigeonhole myself into being, for lack of a better term, doing orthopedics, because physical therapy and orthopedics is very close. But inevitably, everything pushed me to orthopedics and orthopedics. But once I became resident, somehow I started getting more and more excited about joint replacement. So that's the short story, how I ended up being joint fellowship trained guy.
So I have to tell you, my aunt had knee replacement surgery several years ago, and she had both knees done at the same time. And
Yes.
everybody gave her so much grief in the family for that because they thought she was crazy for doing that at the same time. Once she had it done and she was through it, she said she never would have done it any other way because she didn't have double the recovery time. I'm sure
Right.
you have a lot of those kinds of conversations with your patients.
Yeah, I've done plenty of both knee replacement at the same time. We can now even do a bilateral hip replacement. A few years back, it was not a common thing to do. But it still is a little difficult initial recovery time. But for the right patient with the right support, bilateral knee replacement, it still is an option. Not necessarily the best option, but it can be done, and I've done it. I've done it plenty.
Is that the majority of the types of patients that you deal with are people that are looking for hip and knee replacements? Do you do other sorts of things like broken legs or ACL surgeries, things like that?
Oh, absolutely. Now the ACLs and the shoulder ligamentous reconstruction, much like of what I was telling you about the extra training that I have with hip and knee replacement. Dr. Mitchell has it, so I will refer those things to him. But all the fracture works, short of the back surgeries, every fracture, there's not much of anything that we don't do. Both myself and Dr. Mitchell will do all fracture works. And as a matter of fact, I certainly enjoy doing the fracture fixation.
And this fellowship, this is a big deal because you don't get to choose that this is something you're going to do. You actually have to be chosen. You have to apply. Not everybody has that opportunity, right?
To a point, yes. There are very limited fellowships, and what makes it sometimes a little, somewhat, I guess, if you say a little difficult to go to what you want to go to is everybody who wants to do a fellowship want to go to a place where they know they will get the best training. But sometimes what as residents, what we think is the right place for us to go, it has to match with the place that we interview to do the. And so for every fellowship, there are many people who apply for it. So in a sense, it is a privilege when you get to be selected to do the particular fellowship.
Well, let's take a quick break. When we come back, can we talk a little bit about the new hospital and this swanky new OR that you are going to be able to start using next week?
Absolutely.
We are going to take a quick break. When we come back, we're going to continue our conversation with Dr. He is a board certified orthopedic surgeon at Valley Health Orthopedics. I was going to say on Commerce Avenue, but he's not going to be there much longer either because shortly after everybody gets moved into the new hospital next week, the following week, the offices are moving. So we're going to get details about all of that when we come back and chat with him a little bit more in just a couple of minutes.
Got a financial decision to make or a goal to reach, but you don't know where to start? You've come to the right place. Introducing Quick Money Chats with the Northern Shenandoah Valley Financial Education Program. Visit tinyurl.com/Quick Money Chat to schedule a virtual chat with a staff member or trained volunteer. We won't tell you what to do, but we will give you the tools you need to choose wisely. And because Virginia Cooperative Extension is part of Virginia Tech and Virginia State, your land-grant universities, you can be sure that our information is credible and trustworthy. And you'll know that we aren't trying to sell you something. Maybe you want to improve your credit score, or reduce your banking overdraft fees, or even figure out if you can afford to buy that car. Sorting through tons of information on the internet can be overwhelming, and sometimes it can be hard to know who to trust. Schedule a quick money chat and get the information you need to take action. Go to tinyurl.com/quickmoneychat and get financial education personalized for you.
Welcome back to the Valley. Today, I am your host, Janet Michael. Happy Thursday. As you are listening to the show today, it is Community Health Day. This is a regular show that I do every single month in partnership with Valley Health. We are pre-recording with Dr. Mesfin Shibeshi. He is a board-certified orthopedic surgeon at Valley Health Orthopaedics. And I joked when we went to break, Dr. Shibeshi, that you're on Commerce Avenue, but only for a few more weeks, because next Wednesday at 6 a.m. on June 23rd, the new hospital officially becomes a hospital. It's technically not even a hospital.
Yeah, they are really working hard moving the equipment. As a matter of fact, I did my last surgery today, and we were joking around that the movers are literally outside waiting for us to wrap it up. So we're going.
I cannot begin to imagine what it must be like to have done your last surgery today in the old facility and know that this time next week, you're going to be performing surgeries in quite the surroundings. I mean, I've seen the inside of those ORs. That's got to make you feel so over the moon.
Absolutely. I'm glad you went there to look at it. I was telling you that the first time that I saw the area when the ground was broken for the starting of the building, it almost felt like a location that you pick to build a resort. That's how beautiful that area is. I can't get over how beautiful it is when you are sitting with so many big windows looking out, looking at these beautiful mountains with state-of-the-art equipment, large operating rooms with every bells and whistles you can expect from the finest institute, the newest place in anywhere in US. So, the fundamentally what we've been doing, the quality of care, the patient care that we've been doing will not change, because I certainly feel like from orthopedic standpoint, we have been growing a quality service line for orthopedics. It's just that the new hospital will take it to another level of taking us to where we want to be, to provide an excellent orthopedic care where we will be able to provide a community that is deserving community, that any service that we'll be providing will be as good and to a point, if not better than any, bigger places in US when it comes down to orthopedics. So it truly is very exciting time to be around Front Royal.
When Terry and I were taking the tour last week, and for anyone who's listening, if you missed it, the audio tour was last Friday's show. So you can go over to the station's website and listen to that. The quick little video snippets are also on our YouTube channel. You can find the link to that in the show notes of that as well. But Terry and I were talking about how much larger those operating rooms are than they are in the current facility. And we were joking because I think a lot of us think, well, there's so much new technology these days. Why do you need bigger rooms? Well, I took a look at some of that technology and it is massive, but it's going to allow you more movement to be able to do things a little bit easier in the new ORs.
Precisely. And I'm glad you were mentioning about the technology. When I say we were able to provide this quality of care that we were working on, again, to this beautiful, deserving community, we had just a little bit of limitation, how fast, how big we can expand. The limitation being when we're talking about technology, and there are actually very, very exciting technology we're going to bring soon to the new hospital. And I'm hoping that you'll invite me 3 months down the road, what this new technology we're going to be bringing. We have now the framework, and the organization essentially say, we're giving you the place. It's time for us to walk the walk. And this is a part that will get really exciting, that I feel like we've done pretty good job. But any limitation we might have had because of the location and space, now we have the big canvas to essentially draw what we think we should have in this beautiful community.
And separate and apart, even from the OR space, there's an in-house gym that I
Yep.
saw as part of my tour that people can do some of the rehab that's on the same floor as the patient rooms. Mary Presley has quite the state-of-the-art facility there on the ground floor with sleds and weights and all of these really great things that are going to be needed for rehab, I would guess, for a lot of your patients.
Absolutely. Not only for my patient, for the sports medicine patients Dr. Mitchell has been working on. And the interesting thing is we are from the gym, we're separated by a door. That basically means myself or Dr. Mitchell literally opens the door and we'll be able to see our patients. And I told you earlier, my background prior to medical school was a physical therapist. So I have some idea what they do in there too. So I think that is going to be an added bonus that we get to keep very close eye on our patients and continue to have this close relationship with our patients that we're providing care for.
You guys are also moving your office off of
Yep.
Commerce Street into the new hospital. Now, the building that you're in now isn't nearly as old as the old hospital is itself. So,
Yeah.
is it a big difference what your new offices are going to look like versus what you have now?
No, structurally, not really. Some of the things that will be changing is the extra equipments are brand new, but clinically the convenience for us will be a little different because across the hall will be the operating room. One floor up will be where the patients will be admitted. So it is one-stop shop for everything. We'll have in-hospital pharmacy. So this is a full service hospital that we will be able to see our patient, we'll be able to operate on them. We get to see them in the follow-up, essentially in the same building. And we'll have frontline family medicine will be upstairs. This is the initial phase of this hospital expansion, but the framework is really outstanding for great potential for expanding and continue to provide multiple specialty care for our community.
Now, the hospital opens on Wednesday, June 23rd. And I want to make sure, and I'm going to mention this every show next week, that people understand and realize if you have an emergency after 6 a.m. on Wednesday, June 23rd, and you're taking yourself to the emergency room, go to the new hospital. Do not go to the old hospital. How excited are you about the trails? I know from the bio that they sent over that you're quite the outdoor guy. Your interests include scuba diving, long distance running, skydiving, whitewater rafting. Do you ever just need to chill out? Are you going to be chilling on the trails over there for a little bit?
Well, I know it's funny that you say that. I've done all those activities that are somewhat, I don't want to call them irresponsible, but a little bit carefree. Now I have kids, so I think it matters if I die. So I do run. The health benefit is great, but it sort of gives me like my me time in kind of soul search type of time when I am me and my treadmill or the outdoors. I would love to get back to the skydiving and scuba diving, but it's kind of like with my wife when I'm allowed to buy a motorcycle when my kids don't need me anymore.
Well, that, and you also know what kind of injuries can happen from
You're
doing any
absolutely
one of
right.
those sports, even
No.
if you don't die.
Exactly. You're right. So I haven't done, it's been a while. I do miss it. It's been a while.
Dr. Shibeshi, thank you so much for taking some time to chat with me today. It has been great getting to know you. And yes, I promise in 3 or 4 months, when you have your new technology, I will come to you at the new hospital and you can show me what it is and we'll record another radio show. How about that?
You got it. It's so nice meeting you. Thank you so much for inviting me.
Absolutely. I will be back tomorrow. It is Extension Office Friday tomorrow. Karen Poff and I are doing a quick money chat. So she is answering questions about their quick money chat program where you can get information and education about refinancing your house, your credit score, your credit report, all sorts of things. So meet me back here tomorrow a few minutes after noon and I will have that conversation ready to go for you.